So we are 3 weeks post-op. I've been home for a week. Being home's been a bit of a struggle. I want so badly to be able to help with the baby the way I would normally help, and I just can't. I'm still really sore, this arm, so this is where they took the graft from. And in another video, I'll show all like the healing and what it looks like, but it's just a huge chunk is missing out of my arm. And it's hard to, I can move it this way, but I can't really move it back. It's really tight and it hurts, and I'm just super cautious because I don't want to do anything that's going to tear the skin graft and make it healing take longer. My head is healing really well, so that's good. My eye is too, but my face is still pretty swollen. I'm having a lot of anxiety in the mornings. Now that Babe is back at work, it's just been kind of hard, but we have a lot of help. We're staying at my parents' right now so that there's someone here with me and the baby 24/7. Just since I just can't hold her for very long, and I'm not supposed to lift her, I'm not supposed to look down to lift up. Technically from the brain surgery, well, it's not brain, it was like my scalp. They pulled it down to take a piece of my brain lining from here, so they took that. And then I'll take my patch off in a minute, but then took my eye as well, and that's healing okay. The first couple days in the hospital, I couldn't look, but when I finally did, it was a little better than I was anticipating. It's still pretty hard to stomach, but it's something, and at least I can see, and I can walk, I can talk, I can do all those things, but it's been really hard adjusting, and I'm just angry, very angry. I just feel like it would have been one thing, to get cancer and have the chemo and radiation, and then to find out I'm going to lose my eye. It just is, it's been hard to process, but I'm getting there. I'll go ahead and show you kind of what the healing looks like of my eye. So this is where we're at. They went in, it ended up having to be a 14-hour surgery instead of 12, because when they went in, they took the tumor that was left that they could see in MRI and that was lighting up, on the PET scan, was here behind my, behind, kind of in the orbit of my eye, behind my eye, and pressing up against my optic nerve and in the muscles. So they knew they were going to have to take my eye. But when they went in to try and get clear margins, there was actually more even in the right side, like through here and in my right sinuses, that they weren't expecting. They kept scraping, testing, and it kept coming back positive, even though the PET scan didn't show any activity there. So that was a little alarming for them. And because of that, they're wanting to push up radiation. So I just got an MRI, and now we're waiting to get the simulation to start radiation. And they're actually wanting to radiate my neck too, because since there was more that they found over here, they're worried that even though the lymph nodes aren't lighting up on the PET scan, there might be some microscopic activity going on in my lymph nodes. And so they're now going to do radiation here, which will be proton radiation, but then they're going to do regular radiation on my neck, which we just feel like it's just another punch in the gut that we weren't expecting. But they're hopeful that they'll get it, and then hopefully it won't come back. But in the meantime, it's been a bit of a roller coaster. I just feel kind of numb right now. I mean, that's figuratively and literally. My face, oh, there's the baby. My face is still numb, but like a numb pain, if that makes any sense. So if you ever have to have an orbital exenteration, just know you're going to feel very weird. I want my face to feel normal. I don't know if it ever will. I still feel like there's something in my sinuses, but it's just because, they went in and scraped it all out, so it's still healing. Poor girl. Daddy's got her. But just coming on here to process feelings, and so many people have been asking for an update, and we really appreciate the prayers and the support so much. So just wanted to come and give everyone an update. We would really welcome prayers and vibes just for more continued healing, but also just peace as we kind of navigate adjusting to this new normal, because it's been really tough. And I just want to get back to feeling positive. I mean, as positive as possible, so that I can kind of tackle the next couple months as best as possible. I'm very nervous about radiation, about the side effects, and just going down that road. They're going to do chemo as well, which we weren't expecting that either. So it's going to be one day I'll do chemo, and then it'll be radiation every day of the week, a break on the weekends, but do that for 6 weeks. So that's what's next, and we're just kind of trying to take it as it comes, and I'm trying to be as hopeful and able to care for the baby as possible. I'm grateful that I can hold her. Someone can hand her to me and I can hold her, and I'm getting to the point where I can feed her again. So that's helpful. I really just want my strength back. I want to be able to do the things that I am used to doing, and not being able to do that's frustrating. So just continued good thoughts for that. My hair's starting to grow back, so that's good. I hope that I don't lose any more of it. The next chemo we're doing isn't supposed to be as harsh as the one that I was on when it was chemo, when I was on my chemo protocol. This chemo is more to support the radiation and make it more work better, I guess. So it's cisplatin instead of carboplatin. And I did okay on the carboplatin, so I'm hoping that the side effects of the cisplatin are even more mild. But this is where we're at. I did do some post-op videos in the hospital when it was far more swollen. It's gone down a lot, and it'll continue to go down, so this poof won't always be there. It'll kind of recede a little bit into my face. But I've been mostly just kind of like this around the house. So if we go out, I wear a patch, something over my head. But the patch is kind of uncomfortable right now because of the way it sits on my eye, and so sometimes I just end up taking it off, and I'm trying to get used to just looking like this in public. Yeah. That's that's where we're at. Again, just thank you for all your continued messages and support, and I'll try and continue to update, but right now, I know it's been a while, and I just some days don't have the capacity to really even move much, and I'm trying to, so that I don't lose any more strength, but some days it's just really hard, and I just need to lay on the couch and try and rest. And I'm trying to give myself grace and remember that I'm still only a few weeks out from a really intense surgery, and that it's okay to need the time to heal, but I just want to be up and walking and trying to get strength. But we'll get there. We'll get there. I'm trying to remember so many things to be grateful for. I have a beautiful baby girl. I've got a very supportive husband and community. And trying to hold on to those things. So I don't know if I'm missing anything, but that's where we're at. Surgery's done, radiation's next, and just trying to stay hopeful. All right, everybody. Bye.